Welcome to the program. I'm Stephen Stone, Trent University Chancellor and proud alumnus. Today on Trent Talks, we delve into aging together and apart. Joining us are founding members of Trent University Center for Aging and Society, Dr. Mark Skinner, the Dean of Social Sciences and Humanities, and also the Canada Research Chair in Rural Aging, Health and Social Care. And with Mark is Dr. Sally Chivers, Professor in English and Gender and Women's Studies. Mark and Sally will be answering your questions and sharing their insights about aging, care, and community in complicated times. Before we begin our discussion today, could we first respectfully acknowledge that Trent University is located on the treaty and traditional territory of the Mississauga Anishinaabe. We offer our gratitude to the First Peoples for their care for and teachings about our earth and our relations. May we honor those teachings. Sally and Mark, thank you so much for joining us today for this important discussion. And may I say how eager I am to leap into today's topic, since not only am I myself aging, I'm 72, but also both my parents and both my wife Linda's parents are alive and kicking at ages 96, 96, 96, and 98. So let's dig in. But before we address today's questions from the audience, Mark, could you maybe share a bit about why aging is an important area of academic research and how that helps us understand the impacts of COVID-19 on an aging population?
Thank you, Stephen. I'd be very happy to, and I'm thrilled to be here. I think it goes without saying that aging is one of the most important things that's happening at the moment. For a number of reasons, and that's one of the reasons why studying it is actually something that we're really proud to do at Trent. I mean, Canada has an aging population. It won't be too long from now that 1 in 4 people in the country will actually be over 65. And in many parts of the country, especially in some of our rural areas, we're already at that stage. And so from a policy and family perspective, aging is top of mind for many people. The other reason it's important, it's never been more relevant in terms of how we need to understand aging, whether it's from a scientific perspective and a medical perspective, thinking about how we might cure diseases like Alzheimer's and other types of dementia, but also from an arts perspective, the social sciences and humanities, where we need to ask questions about how we can plan for age-friendly communities and how we can make Canada and the society we live in the kind of place that's welcoming for all types and all diverse perspectives and experiences of aging. And that's something we do quite concertedly here at Trent through the Trent Center for Aging and Society, which was founded about 5 years ago to bring together multiple perspectives to help answer some of the pressing challenges about aging, especially to debunk the myths that we have about aging in terms of it being a dependent or a vulnerable type of situation for most people, when in fact many people are resilient and there's all kinds of innovations and exciting things happening in relation to aging and how we think about people. For me, fundamentally, the study of aging really is about thinking about how we care about each other and care for each other. So it provides a lens into how we think about ourselves as a society and how our communities operate. And there's many different ways that we can study that. And in some cases, there's many types of outputs that actually change the way politicians and policymakers and people that are doing work on the ground to make decisions make choices about how we treat older people. And I'd certainly say in terms of COVID-19 and the current pandemic, aging is going to be one of the storylines that's carried through this pandemic in terms of even years from now, and understanding what it was we did to care for each other and how it was we might change things in the future when we do that. And so to me, it's quite a relevant and timely topic. And I love your opening comments about your own family situation. It's what we talk to a lot of our students about, is that no matter what age you're at, you're going to be connected to someone who's older, and you yourself are always going to be getting older. And so it's a very important thing for us to think about.
Well, thank you, Mark. And I look forward to debunking some myths in the next few minutes. And turning to you, Sally, as long-term care facilities are a focal point of the pandemic in Ontario, and indeed the Ontario government has announced an independent commission into Ontario's long-term care system. Could you maybe focus a few brief remarks to help frame our discussion today?
Yes, absolutely. Thank you. And Mark was talking about the importance of the arts. I come from the humanities, so I started studying aging through representations in literature and film. And literature and film tell us that nursing homes are horrible places, places to avoid, and places to escape from, sometimes in a fun caper, but escape nonetheless. And certainly the stories we're hearing right now in the time of COVID-19 seem to be reinforcing that. But I have also, for the last decade, been part of an international research team. We've traveled to 6 countries looking for promising practices to reimagine long-term residential care. And we have found that dignity and joy are possible in nursing homes. And the way that we get to dignity and joy in nursing homes is recognizing how closely linked work and life are in these places. So a good place to work is more likely to be a good place to live, and vice versa. So we're really excited on our research team to see how working conditions in long-term care have garnered public attention. We call this in the research world a policy window, and you're seeing with that commission that you just talked about, that policy window opening wide. So we really have an opportunity right now to make sure that those Hollywood visions of long-term care do not come true. We have a chance to reinvent and reimagine long-term care. And drawing on the research that my team has done, I can confidently say that we have substantive and evidence-based reason for hope.
Well, thank you. I thank you both for helping to lay some foundation for this week's conversation. Let's move right into our audience submitted questions. And Mark, turning to you first. As we endeavor to protect our loved ones, we are encouraged to be particularly vigilant when it comes to the elderly members in our communities. Here's the question. What are some ways we can maintain contact and support when technology is not always the best option for communication? And at the same time, the ability to visit in person is often not possible right now.
Stephen, I think that's actually a really poignant question, probably for most households out there. First, I'd want to say that many of us are quite concerned about our older relatives. And I think that's a normal concern to have, but not just for older people as a category, but also for anyone who's in a vulnerable situation. There's many people who, if we're trying to reach out to them because of their vulnerabilities, it may be the case that they're not over a certain age that we consider elderly, like over 65. They might actually be a bit younger, but still in the same kind of situation. And I think when it comes to the lack of ability to contact people in person, it's really hard to find ways to do that without technology. And I think we've seen the proliferation and some really good advocacy from a number of municipalities and a number of advocates of different associations, pulling information together in terms of the different types of tips and things that people can use. And a lot of it has to do, for example, setting up Zoom meetings and Skype meetings to see people face to face that maybe haven't been done before. But I'd also, and I've heard a number of people, especially in my own neighborhood, talking about low-tech options. And a neighbor of mine who's 70 years old was reminding me that I can still use the telephone to call my mother. And that was a really pleasant conversation to have. What she was really pointing out is technology doesn't have to be high-tech in order for us to make connections. The other thing I would want to point out is sometimes when we ask these questions and we think about them carefully, they often reveal things about, as I said earlier, how we take care of each other and think about how society does that. And the risk with focusing on technology is, in a way, there's the perpetuation of what we might call the digital divide. And here we're talking about, there's some people who won't have access or preparation, for example, to use certain kinds of technology, or they might live in areas that don't have the equipment or, for example, the Wi-Fi capacity. And so there it's important to think about the ways in which families might connect. In some cases, we've heard and seen great initiatives where people are actually driven to each other's homes in order just to communicate out of car windows and in front of long-term care home windows and things like that. And there the focus is much more on connection than it is actually the medium in which it's happening. And so in some ways, that sort of caution about not expecting too much out of technology if people don't have access to it also needs to be held up against our own, sometimes a bit of stigma around the elderly, in the sense that we may think they can't actually use social media and so on. And I have to say, the people that I've been following happen to be older themselves, the ones that are the most active in terms of trying to get information out there, the ones that are organizing our efforts every week to make noise and bang pots for our local hospital and first responders, for example. And to me, that's a really good sign that how we think about aging and the abilities of older people sometimes are actually taken for granted in our assumptions about things like technology.
Well, thank you. And a follow-up question for you, Sally. Outbreaks in long-term care facilities have been widely covered, of course. How can we help to keep our loved ones that reside in these facilities calm during this time of heightened anxieties? And indeed, how can we manage our own anxieties about our loved ones in care facilities?
Yeah, thanks very much. And I'll just acknowledge this is a difficult question because some anxiety is going to happen at this time. I think in general, there is a heightened anxiety. And when you throw long-term care into the mix, obviously that is exacerbated. The first thing I would say is that if you yourself have moved into long-term care or you care about someone who has, trust that you made a good and necessary decision, that was the right place for someone to be at that time. Our research shows us that people are, when they have a choice, going into long-term care because they have to, for the support that's available there. And so the difficulties that are coming up during the pandemic do not change that fact. However, kind of related to what we were just talking about, communication is probably getting more difficult. And I know it can be really frustrating to be trying to phone and get contact with someone and not hear back, and not even hear back from a staff member. So I'd urge you just to think back to what I was saying in the opening remarks about the working conditions, especially right now in long-term care, and understand that staff really know. They know that someone who visits long-term care is coming both for the social and emotional connection, but they're also sometimes doing direct care. So they do miss you, and they would be reaching out to you if they had an opportunity to. So I won't deny that this is hard and that there are a lot of things to worry about. What I would urge in terms of an action that you can do in the meantime is to lend your support to the advocates who are pushing for the kinds of changes that we need now that there is awareness. Support for skilled care workers, better oversight of the long-term care system, and a publicly funded long-term care system. Those are some of the things that are coming up, and that you would know from your experience, whether you're living in long-term care or whether someone you love is living in long-term care. You really have something to contribute to that conversation.
Well, thanks, Sally. And actually, I'm glad, very glad that you mentioned feeling good about the original decision to go into a long-term care facility. I know my parents are at the Sunnybrook Veterans Center, and at first they were very nervous about going in and wondering if the right decision had been made. And now they feel so blessed that they're being looked after in such a good way. So thank you for that. And Mark, over to you. My parents are in Toronto, but many seniors live in smaller communities and rural locations without necessarily the same level of access to services, healthcare, and technology compared to urban centers. Is there anything special or different that we can do in those communities to help support our aging family and our aging friends and neighbors?
Absolutely, and I think that's actually really important question to ask, because many of us, whether we live in cities or not in Canada, we have a connection to rural areas as part, especially we're here in the spring, we're talking about cottaging and so on. And rural Canada and the people who live there in general are at a disadvantage in terms of having less resources, less access to healthcare. There's greater distances and issues with transportation and so on. And so when we think about older people, the ones who are living in rural areas are in a particularly poignant category where we might be worried about how they're doing in terms of isolation and distancing and so on. But all rural communities are not the same. Some are actively able to provide resources, and they've been able to actually, in some ways prevent the spread of COVID-19 because there's a smaller population base. And we have others that are at the moment having this influx, for example, of cottagers coming in, and rural communities are actually quite nervous and concerned about their capacity to deal with that seasonal population. And I think the one thing that links all rural communities together in relation to supporting older people, especially during COVID-19, is what we call volunteerism or volunteering. And that's one of those pivotal things that's happening in rural areas where there's traditionally been a lack of resources and services available. And the voluntary sector and volunteers providing things like community support, Meals on Wheels, visiting programs for older people, has had a really important role to play, both in the health and wellness of older people, but also in terms of allowing older people to participate in their communities through being volunteers themselves. And it's that latter issue that's also become quite important during COVID-19, is many of our older volunteers are actively not able to participate as volunteers. And there was a recent report from Volunteer Canada suggesting that many organizations are losing a lot of their volunteers at the moment because they're older and they're staying home and they're following the measures in place not to participate. And that puts some of our other community members at risk. And so we're thinking about another one of those storylines that might come out of the COVID-19 era. And we think the precarity of older volunteers in rural areas might be something that becomes a bit of a really important issue for us to understand and look into. And I would say that isn't just an issue for rural communities. So yourself, Stephen, and others who live in maybe some larger centers, older volunteers really are keeping a lot of our community programs going. And so that may be something we can learn from rural communities in terms of how they actually respond and keep their services going.
Well, thank you for that. Turning back to you, Sally, and a similar question, but a different way of coming at it. Caring for individuals that are experiencing dementia, whether it's caused by Alzheimer's or otherwise, can be challenging at the best of times for those family and friends who provide the daily support. But most programs and facilities that used to be part of their daily routines are closing down or closed down, adding to the stress and confusion. Are there any strategies that families and caregivers could implement to help ease some of the stress during this time?
Yeah, thanks, Stephen. I'm really glad this question has come up because, of course, long-term care has been dominant in the public imagination and the public conversation. But as you point out, community supports are also affected by COVID and our responses to COVID. And so people who are still living in the community also don't have the kind of care supports that they are used to. And care is, of course, highly skilled work. It's also a relationship that needs fostering and support. So if you're living at home with dementia and or living with someone with dementia, you have probably recently learned how to adapt to change. You're used to life not quite turning out the way that you expected it to. So that is a kind of resource for you to draw on, to know that you are used to navigating these kinds of changes. One concrete resource I would strongly recommend comes out of Milwaukee, actually, from a professor called Anne Basting. That's Anne like an E in Anne of Green Gables. And she has just published a book called Creative Care. And along with that, on her website, she has a creativity center. You can easily find it by Googling it. And that creativity center offers a number of activities, low tech, like Mark was referencing in his response about communicating, that you can do at home to ease tension and to draw on evidence-based research that she's done into non-pharmaceutical interventions with dementia. So I'll give you an example in case you want to get going on it right away. She uses principles from improvisational drama to ask what she calls open-ended, she calls them beautiful questions, open-ended questions. So a question might be, what's the most beautiful sound in the world? And then you can delve into why that is the most beautiful sound in the world. And so there's no right or wrong answer, it's a conversation. This might sound trivial, this might sound light, but it is a way of redirecting, and it's a way of harnessing the imagination and moving the pressure away from memory loss to give yourself a little bit of respite.
Well, thanks, Sally. And now let's get physical. Mark, what can we seniors and members of the aging population do to help maintain our physical as well as emotional and mental health during the pandemic?
Yeah, I think paying attention to all those categories is actually what's going to get us through this individually and also as households and communities. And I'm glad you linked together the physical and the mental and wellness aspects, Stephen, because I think only focusing on one of those aspects, maybe too narrow in a time where, we're really having to be creative in how we think about how we can do things in maybe a confined space. In terms of physical activity, there's a number of different types of, what we'd say, collections of information that have been put together, and one by the City of Toronto, where they've listed all the different arts and physical activity programs that are available, not just for seniors, but for every community member. The city website actually has some really good lists that people can go through and figure out what it is that they are actually interested in doing, so they're not trying to take on something that they haven't done in a period of uncertainty and maybe crisis. And one of our colleagues at Trent often talks about, if you haven't played tennis and suddenly you're 9 years old, maybe starting tennis isn't what you're going to be interested to do. But if you have played or done other types of activities, there will be ways to sort of mimic those through virtual processes, or even just audio recordings that allow you to participate. The one that I want to highlight for everyone is the connection with Canada's National Ballet School. We've worked with them for a number of years now on a program where they've been trying to see how to deliver studio-based dance programs for seniors and deliver them remotely out in community centers and rural areas. And as you can imagine, when the pandemic comes along, that's a really good approach to bringing dance into people's homes. And so they have a whole series of programs available online where they've got 5, 10, 20-minute type videos that people can participate with. And you see people like myself trying to do pliés and different kinds of ballet moves in these kinds of environments, but it's exactly that connection between physicality and wellness that you get through a program like dance. So if I were to leave, the viewers with a suggestion, I think checking out Canada's National Ballet School website would be one of the places that you could start. And I think it does tie into the kinds of things that we're really excited about in terms of Sally's talked about her background in the humanities. I really think there's something special about arts-based approaches to dealing with times like these. And so you never know, it might be dance and ballet that actually pulls you through it.
Good. Thank you both. And that is all the time we have today for our audience submitted questions. But the final question I always like to ask is this: are there any positive lessons we can take forward from this COVID-19 time? And maybe Mark, you could go first.
Thanks, Stephen. Maybe I'll go back to something Sally said at the very beginning about hope. And I was thinking about the chance to participate in this kind of venue. And to me, maybe if I think of my favorite definition of hope is envisioning a future that you want to be a part of. And I think that's an important comment for me to leave with everyone is when we think about, what kind of future do we want in relation to how we care about seniors and how we think about older people in the community and the way that they contribute to their communities through volunteering and other types of activities. I think we need to envision that future together in terms of knowing that it's one that we want to be a part of, and maybe asking some hard questions about how things have gone or how things have gone previously before the pandemic, but actually committing to thinking about how to improve things for everybody moving forward. And that will be my sort of comment for optimism related to hope for everybody.
Okay, well, and Sally, speaking of hope, is there a hopeful message you can leave with us today?
Yeah, absolutely. I've been so heartened to see care coming into the public conversation. There's a new emoji to express care on Facebook. And there's this new term, caremongering, that is actually a Canadian practice that has been launched. And a lot of that means a kind of virtual kindness, a sort of loving kindness. But it was actually started as a group organized by a frontline COVID worker to share and organize community resources. And so I see us moving beyond what we talk about as an ethic of care, which really relies on thinking of ourselves as interdependent, to what we call an ethos of care, where care is infused at the individual level. It's part of the institutional level. We've talked a lot about how Trent is a caring community. Let's really harness that. And then also at a national and even a global level. So we all deserve good care cradle to grave, and focusing on that is what's going to make us come out of this into a more equitable world.
Thank you again, both of you, Sally and Mark, for your insights today. And for those of you at home, thank you for joining us. And I hope you'll tune in again next week as we welcome Trent University's Director for the School of the Environment, Dr. Sean Watmow, and Associate Professor Dr. Stephanie Rutherford, also from the School of the Environment, to discuss COVID and, fittingly, the environment. In the meantime, we do want to hear your thoughts about today's program and also encourage you to submit questions for next week. You can do so by continuing the discussion on social using the hashtag TrentTalks. Until next week, stay safe, and please always remember, you are not alone. Goodbye for now.